you, and you found
They
the evidence
they
and
accepted.
yeah.
And then that what got going. But I would do 10 cataracts in one morning with a microscope.
Right,
If you don't use a microscope, you have to do a lot of stitching,
right.
which means that it takes an hour to do an operation. For me, 15 minutes, 20 minutes for a cataract operation.
That's great. That's really good. And did you bring a photograph?
No. I thought
what
you had
did
the
you bring? No, I do have the photograph.
Oh,
we can work it into the
You should call
system.
down to these because you can later on give them back to me. But this is a
Okay.
good resume.
All right.
It hastens your getting going with the write-up.
Right.
If you read it a couple of times, both of them, they're essentially the same. They're minor differences.
Okay.
You
All
can
right.
call me, I'll come and pick them up.
Okay, we'll do that. And the most remarkable changes in the practice of medicine, other than patient surgery, you mentioned the microscopes. Is there anything else as far as?
Yeah, in my field, the use of the microscope and doing surgery on an outpatient basis have been the major advances during the past years. And of course, then we went to Europe and learned how to do implants for cataracts.
Mm-hmm.
I spent time at the Barricare Clinic in Barcelona and also some time at the major eye hospital in London learning techniques. Made several trips and introduced this area did not have implantation after cataract surgery, so patients wore those thick glasses. I don't know if you saw them in the old days.
I don't
Yeah,
recall.
it was frowning.
Yeah.
Yeah, enormously. So I learned it from my trips to London and also to Barricare Clinic in Spain. And that essentially revolutionized cataract surgery on top of the microscopic surgery.
The implants. And when did you go for the first time to Barcelona and to England?
Barcelona, 68.
And London?
And London more or less the same time, because
Okay.
there was several trips starting around 68.
Right. I was just curious, just for a timeline. And the most remarkable changes that you've seen here at the hospital?
The hospital, of course, has attracted, it was a very, it was probably a minor center. It has become a major center. So far as architecture goes, it's no exaggeration if I say it's 30 times the size it was before. And as I understand it, it is the major hospital in Connecticut. I don't think either in New Haven or in Hartford they have. I know a little bit about them because I had to take my wife who had systemic lupus to those other centers. I don't think any of them are as advanced as our hospital here, admitting to a minor element of bias. I think our hospital is beyond all the others. I do.
Well, I think we agree with you on that. So as far as the people here, are there any names or people that you'd like to mention as far as
In
your
my field.
experiences here at Danbury Hospital?
At Danbury Hospital, of course, John Creasy, the administrator, he was before your time, am I correct?
Right,
But you've seen the name.
yeah.
He is the one who, by having the Lions Club buying me a microscope, got microscopic surgery going, and in essence got my practice going. Because without a microscope, I couldn't do the fine operations that I ended up doing. And undoubtedly, I've done over 10,000 operations with the microscope.
That's great.
But had he not helped me Because the others will say, oh, you don't need a microscope. No, you do need a microscope.
Right.
Because it's a very, very fine organ. The structure is extremely delicate.
Mm.
And without a microscope, you just can't do it.
Right.
I'm not saying that all operations need the microscope, but 95% do.
Right.
In other words, if you want to remove a mold, I use the microscope, but you don't necessarily need to. But you're doing
Right.
glaucoma surgery, retina surgery, cataract surgery, you best know how to use the microscope.
And is there anyone else besides Mr. Creasy that you'd like to mention?
John Creasy,
Is there anybody else besides Mr. Creasy?
in the field of eye surgery, it was John Creasy.
Okay. All right. And
By the way, Robilati, I know his name, at least used to be, yes, he
Right.
helped me a great deal. But 90% of it was John Creasy.
have you had any students at all? Have you instructed any students as
Yes,
far
for
as?
years and years, I used to drive to Albert Einstein to train the residents. And some of the residents at the big group in Danbury were understudies to me.
Oh, nice.
Yeah, at Einstein.
Yeah, that sounds great. What are your some of your fondest memories or given you the greatest satisfaction in your career?
I must have been born to be an eye doctor, so the biggest satisfaction in my life has been getting good results doing surgery.
Mm.
I'm sure that I have made mistakes. We are all human.
Mm.
We make mistakes. But patients have always been forgiving of me if I did my best but things didn't turn out the way they should be. It's well known that anything that you touch by hand is given to errors or bad results. That's inherent in nature.
Right.
In fact, you may not want to write this, but I always say, even God makes mistakes. Doctors make a living off God's mistakes. So we make mistakes. And if you have, this is a lesson for young doctors, you have good human relationships with your patients. You make mistakes, you get bad results, they will forgive you.
Yeah. Well, sometimes mistakes happen.
I'm a living example to that. I'm not saying that I didn't make mistakes.
Right.
I'm sure I made tons of mistakes. But did the patients get after me? No. Very basic. Some doctors, particularly surgeons, think that they should not be questioned beyond. Not the case. We all make mistakes. We have to be humble. We make a mistake, you tell the patient what the mistake was.
Right.
And the patient will be forgiving of you.
Right. If you own up. That makes sense. And are there any other prominent people at Danbury Hospital that you'd like to mention at all, besides Mr. Ovalati and Mr. Creasy, that had an impact on your life?
I haven't been in touch. As you know, I've been doing, up to the end of the years that was 15 years ago that I did, I've done minor surgery at the hospital.
Mm-hmm.
I mean, not my office. My major surgery was up to 15 years ago.
Okay.
And in my mind, it was Robilati
And Creasy.
I'm sure there are new people, top people
Okay.
that I haven't had the privilege of meeting. I've been sticking pretty much at my office for the past 15 years.
No, that's fine. You seem to be doing great.
Yes, any surgery I did was minor. Up to 5 years ago, that I gave that up as well. I don't do any surgery now.
Okay.